Rest assured that we have been working behind the scenes to provide an adequate network and resources for the approximately 75,000 children who will soon be eligible for the Pfizer vaccine. First, I just want to mention the recommended default approach, like all other vaccines. Parents can get their kids vaccinated through the healthcare system serving their child, if that healthcare system is a vaccine provider, and or at a local pharmacy. Most of the major chains, as you know, are providing COVID vaccines and will be participating in the pediatric lane of activity as well. We anticipate expansion of the state's vaccine finder tool to assist parents in this. And again, this permits an opportunity for updating on other vaccines and catch up on well child care that is not available through a mass vaccination clinic. Meanwhile, to create a safety net for children whose parents are unable to achieve vaccination through the usual mechanisms, the health district has been working with many school districts, pediatricians, clinics, and pharmacies to try to match them up for school-based clinics to reach children who aren't otherwise going to be able to access vaccine. We're look for information on that to emerge through your school system as that develops. We've also reached out to local pediatricians and pediatric clinics to understand their plans for offering COVID vaccines and where we can support them and fill gaps to reduce any barriers to participation they may be experiencing. The federal government is directly shipping vaccines to clinics and pharmacies, just as they have been doing since earlier this year. And at the health district, we are working on contingency planning to offer supplementary capacity to basically be the safety net for the safety net. But we want to make sure providers and pharmacies have enough supply for their patients and plans first. Quantities of vaccine forthcoming for 5 to 11-year-olds may be somewhat limited in the beginning as the manufacturer scales it up for nationwide supply, and then the distribution system gets it out to the branches of the tree for administration to kids. As we experienced in the rollout of previous vaccination efforts with COVID, like think of last winter, there's more demand than supply early. Then as that initial surge of demand gets met, things kind of calm down. So not everyone, though, is going to be able to get their child vaccinated the first week. It's just mathematically impossible. And if, we estimate that, let's say, roughly maybe 100,000 doses might be coming to the state for the coming week or so, and Snohomish County gets its per capita share of roughly 10%, that would be somewhere around 10,000 doses. And if we've got 75,000 eligible kids, let's say there's 50,000 whose parents are really excited about this, that's still going to take 4 to 6 weeks for many of those kids to get their first dose. So we urge patience and continued participation in the other prevention efforts through the community and school venues, all the items that Executive Summers mentioned, including, but not limited to, influenza vaccination, which can also make children and adults very sick and can exacerbate any hospital surge caused by COVID in the coming months. Just a reminder, if you make an appointment at one of the health district's mass vaccination sites, if you make that appointment for a 5 to 11-year-old, it will be automatically canceled. We will not have pediatric doses on hand at our mass vaccination clinics. Again, please reach out to your child's primary care provider and/or your local pharmacy once CDC and the Department of Health complete their steps in this process. And again, just want to urge everyone's patience. It's been a long time in coming. I'm sure you're all anxious, those of you with young children who are interested in this vaccine, but we just can't do it all overnight. And like previous efforts, it's going to take some time to phase it in.